I want to welcome everyone and happy National Nursing Week. I'm Mary Smith. I'm a registered nurse and Executive Director of the Association of Regulated Nurses of Manitoba, and so glad you've joined us tonight for this very special Talk Tuesday featuring Manitoba's own Dr. Claire Betker, the President of our National Professional Association. What I would like to do first is acknowledge that the association is proud to recognize all of the traditional territories upon which the nursing profession works. We acknowledge that we are in Treaty 1 territory and that the land on which we gather is the traditional territory of Anishinaabe, Cree, Oji-Cree Dakota, and Dene peoples and the homeland of the Métis Nation. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in the spirit of reconciliation and collaboration. So before I hand it over to Melanie, our facilitator for the evening, I'd like to add a bit of an interactive component just to get you using the Zoom by asking you a couple of questions. So one of the first ones that I have is I'd like to ask you, how did you hear about our Talk Tuesdays? So the poll is up there. We'll give a few seconds for everybody to post their answers. Great, it's nice to see that we're seeing a variety of responses, the e-news and our website and Facebook, all of those channels that we're currently using. So it's good that that's meeting people's needs. And awesome, we've got some friends and colleagues are passing on the news, which we very much appreciate. And there's just the results there. So we're still finding consistently that our e-news is the way to communicate with you, our members and other nurses, to get information. So that's awesome. And then the second one that we have for tonight is, was the online registration easy for you? So this is one thing that we're finding consistently, is that most people are finding it quite easy, but we're still having people commenting that it's somewhat or no. So in those situations, please don't hesitate to give us a call. We're working remotely, but we're still working 100% of the time, so that you can just give us a call and we'd be happy to help you out through that. So these were just showing you that we've still got a few people that didn't find it as easy as you would like, and we would like to definitely remedy that for you. Okay. So finishing that, now I'm really pleased to introduce for you tonight our facilitator, Melanie Gazelle, a registered psychiatric nurse who's going to get us talking.
Thank you, Mary. Yes, I'm a registered psychiatric nurse, and I have a psychotherapy practice in rural Manitoba here, and I'm also a psychiatric emergency nurse for Southern Health Santé Sud. So happy Nurses Week, everyone. I am so pleased to be here with you on our fourth Wellness Matters Talk Tuesday, which is a live virtual forum that takes place every Tuesday night from 8 till 9 p.m. And we are very excited for tonight's forum during Nurses Week to celebrate all regulated nurses as leaders and to showcase the ICN CNA theme, Nurses, a Voice to Lead, Nursing the World to Health. So just a reminder of, before we get started, just a reminder of the Zoom instructions for those of you new to Zoom. So I'd like to take a few minutes to review. So the first 30 minutes will be in a webinar format where all participant microphones will be muted. And during this time, if you have a question, you can use your question and answer icon on the bottom of your toolbar to pose that question. And if you're having any technical issues with that, please feel free to select the chat button, and that way our technician can help you out with that. And when you are posing a question or comment, you can use the drop-down menu, and you can either share that with everyone, just privately with me, or the host, or anonymously. Following the presentation, I will read out the questions or comments listed so that Dr. Claire and myself can respond. And then throughout the discussion, you can continue to pose your questions using the question and answer or click on raise your hand. And when you do that, we'll be able to unmute and you'll be able to voice your question directly. And that would be a little more interactive if you'd like. So our goal for Talk Tuesday is to really have the opportunity to get together, to share our feelings, or to share stories, to talk about current stressors, to discuss coping strategies for each other, and to feel that we're in a safe place where we can be open with one another. We also just want you to know that we'll tape the presentation, but we tape it so that we can post just the presentation part and not the comments and question part. We keep those questions and comments confidential. A link to the PowerPoint and related question and answers will be posted to the Talk Tuesday website. So with that being said, I am now very pleased to introduce Dr. Claire Betker, registered nurse and president of the Canadian Nurses Association, to present on tonight's topic, Nursing the World to Health, a Story of Gratitude.
Okay, so I'm just trying to figure out oh, there we go. I can see hi everybody. I can see the slides. So thank you, Mary, for, I'm going to ask Mary to move the slides along, and most of them are pictures. And some of you that are online, I see in the participant list, will recognize yourself in a couple of the pictures. So thank you so much, Mary and Melanie and Lisa and your board, Jennifer, and everyone for inviting me here tonight to your Talk Tuesday. And what a great idea to have these conversations and this safe space, as you said, for nurses to come together, especially in this time. So as you know, this year we had the really unique opportunity to raise the profile and the impact of nurses and nursing globally, because the World Health Organization declared this year the International Year of the Nurse and the Midwife to commemorate the 200th anniversary of Florence Nightingale's birth, which was today. And she was born in Florence, Italy, and thus the name Florence. So when they declared that 2020, the International Year of the Nurse and the Midwife, nobody could have imagined the significance of 2020 and the call that nurses around the world have so ably answered and are still continuing to answer. And it's interesting, some of the words that were said when that declaration was made by the World Health Organization, and when the Director General, who we all kind of now recognize his face, Dr. Tedros, when he stated that 2020 would be dedicated to nursing and to midwifery, he wanted to highlight the enormous sacrifices and contributions of those professions. And he really wanted to ensure that globally we would address the shortage of both nurses and midwives. So that's a very almost prophetic kind of statement. And in response to that, Annette Kennedy and her pictures in my slides responded from she's the president of the International Council of Nurses, and she comes from Ireland. She welcomed that recognition and that acknowledgement, and her quote was that around the world, nurses are working tirelessly to provide care and attention that people need whenever and wherever they need it. Again, a very prophetic kind of statement as we've sort of seen our lives and our world and our communities just really impacted by the COVID-19 pandemic, and in a very, very short period of time. So before I get going, and I said that I wanted to maybe just share with you some of my experiences as the president-elect and the president of the Canadian Nurses Association, and some about what we see as our future and where we're going, and where the Association of Regulated Nurses in Manitoba and yourselves could really get involved and be engaged in that. I just want to start by saying thank you on behalf of myself, on behalf of Tim Guest, who is the president-elect, and the officers, Michael Villeneuve, our CEO at CNA, our very dedicated board of directors, of which Jennifer Dunsford is your rep on our board, and all the staff at the Canadian Nurses Association for all that you're doing every day in this very, very difficult and unprecedented time. So a very, very sincere thank you, and a very sincere acknowledgement and recognition of the contributions that you and your colleagues and that nursing across Manitoba is making. So I called it a journey of gratitude because I do feel very grateful, and I have a lot of gratitude for what has occurred over the last 4 years. And the definition, and those of you who know me know I like a definition, is that gratitude means thanks and appreciation. And it means being thankful and also pleasing. And when you feel gratitude, you're pleased with what someone or somebody did for you, and you're also pleased by the results. And so different than being indebted to someone, I feel a lot of gratitude for the opportunity, and the Association of Regulated Nurses of Manitoba played a really key role in that and has continued to be a tremendous supporter. So next slide, Marion. I'll just maybe start to tell you a little bit about myself. So this is where I started my career, and this is in Souris, Manitoba, about 4 miles, 2 miles east and 2 miles north of Souris, Manitoba, on the family farm. And my brother-in-law and his family continue to farm on this farm. And that began in 1977, actually, when I graduated from the University of Manitoba from the Faculty of Nursing here in Winnipeg. So throughout my career, I've worked in small rural communities, Souris, Hartney, Elgin. I've worked in large urban centers here in Winnipeg. I've worked at a regional, Westman region it was called then, at a provincial and at a national level. And I've actually had the opportunity to work in all 5 domains of nursing. So in practice, which is the foundation for me, administration, in research, in education, and in policy. So that is, I'm very, very grateful and have a lot of gratitude for that. I'm the mother of 5 children, and I think one of them is online, Claire Betker here, and I'm the grandmother of 2 beautiful boys and 1 gorgeous little girl, Georgia. And Cole and Connor are the boys. I live in Winnipeg, Manitoba, and right now I'm the 48th president of the Canadian Nurses Association. And we've been in existence, the Canadian Nurses Association, for more than 110 years. So 48 presidents is not a large number when you think that there are about 430,000 regulated nurses in Canada at any one time. But I'm also only the 3rd president of the Canadian Nurses Association from Manitoba. And the first was Helen Glass, and we all know that name. And the second was Karen Neufeld, and I'm the 3rd. So there can be more Manitoba reps and being the president of the Canadian Nurses Association. So for those of you out there, I put that challenge out there. So I just wanted to say that where I practiced was on Treaty 1 territory. We practiced then as a public health nurse was the role that I was in. And we practiced from what we called a district nurse model. And so we were the community's nurse, and we worked with them from preconception all the way to death and palliative care at home. And it was a very holistic model, and we were in very strong relationship with those communities and with the people that we worked with. It was a very formative part of my career. Absolutely, I still draw inspiration from it. And we were leaders, and we led where we landed, and we were expected to be leaders. So when I say that I believe all nurses are leaders, I mean that right from the get-go. And the communities taught me. They taught me many things about how to be a nurse, about health promotion, about the social determinants of health, about equity, about how to be a farm wife, how to be a mother, and many other things. And those were very formative, and I'm very grateful to those communities for their patience with me as a young and early career nurse in those days. So next slide. And I show this slide pretty much wherever I go. So my leadership journey when I reflect on it, really involved professional nursing associations. I drew a lot of inspiration from them, a lot of support. They validated me, they challenged and helped me to grow. And I found them, just like you talked, Melanie, about tonight, as being a safe space. And so that includes the Community Health Nurses of Canada, the Association of Regulated Nurses of Manitoba, it still says registered there, the Canadian Nurses Association, and I'm also a certified community health nurse. And the significance of that is that that was probably when I became the most significantly involved in professional nursing associations, and that was the early 2000s. So, you know, just coming on to now 20 years ago. So it wasn't early in my career, it was sort of mid-career when I got really involved in professional nursing associations. And I stepped up and was asked to be on the standards and the certification development committee for community health nurses, and I've been certified ever since in 2006. So next slide. So here I am in St. John, New Brunswick in 2016. And I must say, really honestly, I never thought that, it never even occurred to me that I might have the opportunity to be the president of the Canadian Nurses Association. But my nomination came from two directions. The Community Health Nurses of Canada approached me and asked if they could nominate me as president-elect. And within 24 hours, some of the folks, and some of them are online, from the network of registered nurses, then we called ourselves, but the precursor, or the first organization before the Association of Registered Nurses of Manitoba, approached me and asked if they could nominate me. So I was actually doubly nominated, one from our jurisdiction here and one from the Community Health Nurses of Canada. And the fact that it came like that, and within 24 hours of each other, I thought, you know what, Claire, you really need to listen to that call, and you really need to step up and let your name stand. The person standing beside me there in the green coat, her name is Vicky Smyth, Dr. Vicky Smyth. She is a professor. She is a great human being and a great nurse. And, you know, it's difficult to run against somebody. And when there's two of you, one of you is going to win and the other one is not going to win. And, you know, I really appreciated that Vicky stepped up and also found that courage to stand in front of her peers and ask for their support and to be elected as president-elect of the Canadian Nurses Association. And there's Stephanie giving me a hug as the results came up on the electronic vote there. So thanks, Steph, for sitting beside me and supporting me through that. So when I ran 4 years ago in 2016, as I wrote my speech, I talked to about 20 nurses across Canada, people that I thought either had been involved in the Canadian Nurses Association or involved in nursing, people whose opinion I thought would help me get prepared to sort of campaign and write my sort of platform. And it was really interesting to listen to them then, and it's very interesting 4 years later to think about their words. And what was important to them is the question I asked from Canadian Nurses Association. And what they said is that we needed a shared vision for nursing and for nurses in Canada and for the Canadian Nurses Association. We needed a united nursing voice. Which is really interesting, and I'll track a little bit of that as over the last 4 years. And they really stressed the importance of working collaboratively and in partnership and as a collective. And what I wrote here is, and they really said, we are stronger when we work together. And that really resonated with me. It really resonated with my I showed you my formative days of my career, where we worked in collaboration and in partnership with those communities, with our schools and housing and social services and whatever they were called in those days. So those collaborations were really important to me as a practicing nurse, along with the rest of the health system. So those messages really resonated, and they stayed with me over that time. The next slide is in Ottawa in 2018. So here's when I was being presented the chain. There's a chain with 48 names on it, 47, I guess, on the chain at that point in time. And so my name will be added to that chain of office. And you can see there Stephanie, the young woman, the blonde young woman is our daughter, Stephanie Betker, a registered nurse here in Winnipeg. And the young woman in the white shirt with the dark hair is Kate Hodgson, also one of our daughters. And she's a registered nurse and works in the Interlake Eastern Health Region. And so I'm very proud of our two daughters, and you can see them kissing me there. And you can see the emotion because the Canadian Nurses Association asked them to put that chain on me there. And I didn't expect that. I was surprised. And you can see me trying not to do, as Kate would call it, the ugly cry, because I had to go from there over to you can see me at the podium and speak to the crowd as I took that chain of office. The woman in the red jacket is Barb Shellian, and Barb was the president-elect as I was, was the president as I was the president-elect. And Barb was elected here in Winnipeg when the Canadian Nurses Association convention was here in Winnipeg. And Barb comes from Canmore, Alberta. And I got to say, you know, when late in your career and you find yourself beside somebody, not of your choosing, right? We just by accident or by happenstance came together, and that you can work so collaboratively with someone in such a cohesive kind of way and learn and grow together. I am extraordinarily grateful and have a lot of gratitude for that, because that's what happened between Barb and I, and it was an incredible 2 years to just sort of tuck in beside her. We were stronger together, and we worked incredibly collaboratively together. So I'm very, very grateful to Barb for her wisdom and for the contribution that she made, and she worked so hard over those 2 years as she was president. In the middle picture there with the blue background is Tim Guest. He's the president-elect. He's a registered nurse from Nova Scotia, lives in Halifax, Nova Scotia. And again, it's been an incredible opportunity to work with Tim. Our experiences together kind of span the whole continuum of the healthcare system. So where I might come up a bit short in terms of my understanding and knowledge in an acute care setting, he is right there. That's his background, and he's very, very solid in that, and very solid in the big health systems kind of picture. And Tim will be an incredible president. And again, he has been just a really, really strong colleague over the last 2 years. But right at this conference here in Ottawa in June of 2018, we made a very, very historic vote, one that had been to the floor of the annual general meeting of the Canadian Nurses Association actually a couple of times, to open our membership to all categories of regulated nurses in Canada. So that would include licensed practical nurses, or registered practical nurses as they're called in Ontario, registered psychiatric nurses, and of course, still would have nurse practitioners and registered nurses as part of our membership. So that was a really historic moment and a really historic meeting in June of 2018. And, you know, it was about then building that, go back to those 20 people I talked to, that united profession, that inclusive organization that honored diversity, but also opened its arms to all categories of nurses. So the work began actually on that day. So the next slide is the 3 words that I used in my campaign in 2016. So next slide, Mary. And I just wanted to just sort of bring them back, because it's interesting when you reflect back over something and you see what you actually said 4 years ago, and really they still ring true. I might not use the alliteration now, but anyway, they made sense in that day, and they still make sense. So my commitment in 2016 was to build a strong, strategic, and unifying voice for nursing and for health. And I'll show you some photos and hit some of the milestones that we collectively have done over the last couple of years. And I think we are building a very unifying voice for nursing and for health in Canada. Bridge was a word that was in my mind at that time, and really bridging those relationships both at a local, so at that community level, at a provincial, territorial, and at a national level, so that we could identify solutions to some of the challenges. And we've seen some of those challenges right now, especially in our long-term care sector with the COVID-19 pandemic in Canada, and be able to take that collective action to work together where we each have something to bring to that table to go to positive change. And then really believing that we're all leaders and that our collective voice and our collective action is what will advance nursing and that will advance the health of people living in Canada. And that really a strong and relevant and a united Canadian Nurses Association was essential to that effort. So I've not touched that slide. That's what I wrote. That was part of my campaign in 2016. So next slide, and this is really just giving you a bit of an idea of what my journey has been over the last few years. So I have had the privilege of being coast to coast to coast. And in this picture, and this is what I could actually successfully pull off of my iPhone, and my computer just didn't really want to download my pictures. And so these are the ones that I could actually pull off. But what you see here is me in, I'll just start in the upper left-hand corner there. Right there, I'm in Selkirk, Manitoba, and I'm at their last year's National Nursing Week celebration. They gave me a beautiful plant for being there, and that's in their auditorium in the Selkirk General Hospital. Right over to the right with that beautiful stained glass behind her there, I'm in St. John's, Newfoundland, and that is where the home of the Newfoundland and Labrador Nurses Association, and I've been in actually in Newfoundland more than once, and that's the president, Elaine Warren, and the Lynn Power, the CEO of the organization. And I won't name everybody in all these pictures, but the middle ones are when I'm in Saskatchewan. I was at the Saskatchewan Registered Nurses Association. I was also at one of their educational days. Down in the bottom left-hand corner, there I am speaking again in St. John's at doing a keynote. And those are three young women who did a presentation, just a spectacular presentation on STVBI, on sexually transmitted infections and bloodborne infections, and their work on the streets of St. John's. And then just over to the right there, I'm in Whitehorse, Yukon, and I'm visiting their Aboriginal, their Indigenous services program, and that's our board member, Christina Sim, and our public rep. And then finally, in the one where I'm doing the selfie, those are forensic nurses in Antigonish, Nova Scotia. And they have a meeting once a month where they come together and they support each other. And each one of these nurses actually has another job, whether they work in labor and delivery, primary care, whether they work in long-term care. And then they come together, and they are the forensic nurses who do the actual investigation and assessment and examination if a woman is sexually abused. So they do very, very important work, and they were a really very tight and close group of nurses, and had asked me to come and to speak to them in Antigonish, Nova Scotia. So I've been coast to coast to coast, and in the last 4 months, we were out there talking about our brand and about how to build an inclusive Canadian Nurses Association. And we actually heard resoundingly, we talked to more than 1,000 nurses in 50 meetings, that a national professional nursing association is needed now more than ever to unify the profession, to support excellence in practice, to speak to the value and the contribution of nursing, and to advocate for an effective, sustainable health system. And I wrote that, before COVID-19. And to me, it's just been amplified in our response to the pandemic. And so they called, really those 1,000 nurses we talked to, mostly Tim and I, called for us to build a diverse, an effective, and a unifying organization that would take the Canadian Nurses Association and Nursing in Canada forward. And I am so grateful to those 1,000 nurses who gave us their time and lifted their voices, and their voices were strong. We asked them the question and away they went, and we got an enormous amount of information. So they shared their thoughts, and they shared their feelings and their passion, and they shared their very, very excellent ideas. So the next slide is a number of places that I've been, again, sort of coast to coast again. One of the commitments I made is to say yes if I could. If someone asked me to speak or to come or to do something or to be on a webinar or to send comments or greetings or whatever, if I could say yes, then I said yes. And so these are some of the conferences that I was at, and they really were celebrations of excellence and of leadership. And I was at the NSWAC, they call themselves, so that's the National Specialty Group for Wound and Ostomy and Continence Care. And oh my gracious, what a energetic group, and what incredible expertise they had in wound, in ostomy, and in continence care. I was at the emergency nurses, I've been at the Community Health Nurses of Canada, and I've been at many others. But the one thing I wanted to point out there is the two slides, the two pictures on the bottom row in the middle there. In both of those, there is the president, Leah Bill, and the CEO, Marilee Nalgizek of the Canadian Indigenous Nurses Association. And CINA, as they call themselves, and CNA have a partnership accord or a partnership agreement. So wherever we've been able to work together or collaborate or complement each other, we've really tried to do that. And these are two examples where Marilee and Leah and ourselves were together at different conferences and different events. So the next slide. And you can, this is a little bit about me in some ways, but Remembrance Day is very, very important to me. And I actually was able to be at the monument here in Ottawa on Remembrance Day, and I was able to lay the wreath in the 4 years 3 times, and I really, really appreciated that. And so our board of directors comes together in November, and part of that time together in Ottawa in November includes the celebration of Remembrance Day. And in the bottom left-hand corner, that's our chief nursing officer from the armed forces. And there's some of our board members there. I think there might even be Mary and Jennifer. But that's in the Center Hall, which is now closed for renovations for 10 years. So we were very, very privileged to be there and to be together and with our colleagues, our fellow nurses from the armed forces. And right above it is the Indigenous monument, and that's where our board member, our Aline Laflamme, our public rep, who brings an Indigenous perspective, she's an elder, to our board, actually was very, very pleased to lay the wreath on that in that year there. But we have an excellent, excellent board of directors, and this is just sort of some of the celebrations that we've done together. Very dedicated, very, very committed, and they carry big jobs, paid work, and then they carry the presidency of their provincial and territorial organizations, and then they also are on, from a governance perspective, on our board of directors, and they take that very, very seriously. And during COVID-19, we've been meeting with them now every Friday for about an hour and a half, and really helping us to keep our finger on what's going on across the country and where those hot spots are. Because I've had 2 opportunities to meet with the Minister of Health, the Federal Minister of Health, and her question both times were, Claire, what are you hearing from nurses? What are they telling you? And I have very limited access, right? But through our board and through our jurisdictions and through folks like Mary, who's working with Jennifer, we're able to kind of get the sense of what's going on out there. Okay, and the next picture, or the next slide, this is really about our international. And one of the things that struck me, these are some photos in Vancouver, where we launched the Nursing Now campaign for Canada. And in the picture to the left is Annette Kennedy with myself, and she's the president of the International Council of Nurses. And the other sign is the Canada sign when I was in Singapore at the International Council of Nurses National Nursing Association's meetings and proceedings. And I got to say, you know, when you sit there and you look at, and that's why I put this picture in and not some of the others, when you look at my name tag is right beside it and you see your name and then you see the name of your country and you realize that you're with, you know, over 130 different national nursing associations, and you're really talking about the world. I mean, it's an incredible feeling and a tremendous sense of pride and, again, gratitude. But the one message I really wanted to be clear about is Canadian nursing and Canadian nurses are unbelievably well reputed around the world. Our education, our professional associations, our regulation, our unions, our students, our nurses ourselves are really, really well reputed and held in huge esteem and regard. And so that was pretty darn cool to be part of that. I had a number of opportunities, and I actually would have been in Geneva tonight and at the World Health Assembly over the next few days. But you know, not to be, and here I am with you, and that's okay. So the next slide. These are some of our partners, and this is, many of you will know, Linda Silas, the president of the Canadian Federation of Nursing Unions, and in the middle is a representative from the CNSA, the Canadian Nursing Students Association, and we were speaking at CAUSN. And so it was a good picture of partnership. And the other one is I'm in St. John, New Brunswick at the CFNU Congress, and they attract over 900 nurses to their conference and to their Congress. And so I was able to say that I've spoken to thousands and thousands of nurses, as Linda Silas would say with her New Brunswick French accent. But we really are stronger together, and I put in that hashtag stronger together. And our partners and partners that I've had just a tremendous privilege to work with include CAUSN, include CNPS, the Canadian Nurses Protective Society, Chantal Leonard, and that organization, with the Canadian Federation of Nurses Unions and their member organizations, their board of directors, the Canadian Nursing Students Association, very strong, very vital organization, CCRNR, the regulators for registered nurses, the RPN, registered psychiatric nurse regulators, we met with them. I've met with the licensed practical nurses regulators, the whole group of them, I think twice. We've met with the Canadian Medical Association, the Canadian Association of Social Workers. Today on our Coffee with Claire was the Canadian Association of Midwives, and the list goes on. We tend to call them the C groups, and really are working hard at developing those partnerships and those collaborations, and because we do believe, and I believe, that we are stronger together, and we share together so many of those solutions. And when we all work together, I mean, things really do move and the agenda advances. So that was a really critical and key part of the last few years. Okay, so the next couple of slides, just some of the things that just strike me as being so good about the Canadian Nurses Association, and they will continue on into the future. First of all, their products and tools. They work hard on those. You can go to the bank on them. Their position statements, the code of ethics, their position papers, their evidence reviews. Many of their documents become really solid references for many of us across the country and over the years. Their certification, their support for practice excellence. As I said, I saw so many examples of excellence in practice and leadership. They support the whole network of nursing specialties, which is a really vital and vibrant network. And are establishing right now a leadership academy. And right now we can nominate people to become those first fellows in that leadership academy. And there's a number of you that are online tonight that I think would be really worthy candidates. And we should think about collectively nominating some of our Manitoba nurses to be a fellow in the Academy of Nurses that's a part of the Canadian Nurses Association. And many of you know and see that picture of Sarah Painter there, but that's in the very first issue of the Canadian Nurse that went fully online. And it's been a real success, and it's kept its boots on the ground. And they have more articles that are being submitted than they actually have the capacity to publish. And most of them are stories of practice in the field. And wherever I went, I encouraged nurses to think about what they had and what stories they had to tell and where they might want to work together to get something into that Canadian Nurse. So I'm very proud of that. Next slide. And I think one of the things that the Canadian Nurses Association does really well, and that's our advocacy at that federal level and the support of advocacy at the provincial and territorial level. Whether we're talking about medical assistance in dying, whether we're talking about a dementia strategy, whether we're talking about calling for a review and redesign of our long-term care sector now after what we're seeing in this COVID-19 response in Canada and in very particular parts of Canada. You know, whether we're calling and advocating for pharmacare as part of our insured services in Canada, or whether we're talking about climate change and joining with the Canadian Public Health Association, the Canadian Nurses for the Environment, and advocating on Parliament Hill for those issues. I think that we're very good at that, and we need to keep that, that opportunity for nurses and for nursing strong, vibrant, and alive. Just yesterday, Michael Villeneuve, who's pictured there on the far left, was in front of a committee of cabinet in Ottawa, speaking about the response to COVID-19, and he said it was very humbling how seriously they took the voice of nurses and nursing in Canada. So just like our respect internationally on that, in those particular halls there and of the federal government, and I think in every provincial and territorial government, nurses are taken seriously, and that advocacy is a very, very important contribution of the Canadian Nurses Association. Okay, so I just want to just end with this. This is, it is Florence Nightingale's birthday today. And this is a quote that I think is a very important quote written in 1893 by Florence Nightingale, where she said, "Health is not only to be well, but to be able to use well every power we have." And I think she was speaking both to individuals and the power that they have, to families, communities, but also to nurses and nursing. And so within that theme right now, that International Nurses Day and National Nursing Week, Nursing the World to Health, sitting that in the context of the COVID-19 pandemic is a very important time for us to think about that and nursing the world to health. And so really, I guess the call or the answering the call would be to marshal the spirit of our past to build our future, and really being able to answer the call that both society, but also our members and our colleagues and our partners and others are asking us to answer. So that is my story very quickly over the last 2 and 4 years. It's actually 760 days and I have about 30 left. So I'll treasure every one of them. And then my time with the Canadian Nurses Association will be over. So Melanie, I don't know if there's any questions or comments, or if people want to ask or say anything. I'd be most happy to engage in a conversation.
Well, thank you, Dr. Betker. Just what an amazing story. Thank you for taking us through your journey this evening. And a special thank you from our discipline, the registered psychiatric nurses, is just from hearing your perspective and the work that you've done in the advocacy to bring us on board with you as well. That's just so much appreciated from the psychiatric nursing perspective as well. Mm-hmm.
Well, and it's only going to get better. So that's
it's very, very exciting. So yeah, I'm really encouraged by that for sure.
Yeah, thank you.
Yeah. So I'd like to now open the forum for questions for Dr. Betker from the audience. So just a reminder, you can use the question and answer box, or you can use the chat if you'd like to voice your questions. So our first question, is it time for Canada to have a chief nursing officer?
So yes, absolutely, it's overdue. And you know, this World Health Assembly that was to occur and will occur in mid-June virtually, we were really hoping that we would have a chief nursing officer that could be sent to that World Health Assembly in Geneva that was to occur in the next few days. And you know, I did 8 CBC radio interviews today, and I think I tucked that into 5 out of the 8. So what are you advocating for? I had a number of things, and for strong nursing leadership in the form of a chief nursing officer in every province and territory. There is some in some provinces and territories, but not consistent across the country at a level where they are at senior leadership and decision-making tables, and for sure at the federal level. And I actually even suggested both times I talked to the federal health minister that she would do well to have a nurse beside her and helping her in this time. And she wasn't opposed to it, but I don't think anything's happened. But I would absolutely agree it's time for Canada to have a chief nursing officer, for sure.
So my apologies, do they have them in other countries, chief nursing officers? And okay. Mm-hmm.
Yeah, and the World Health Organization has a chief nursing officer. Her name is Elizabeth Iro, and she comes from the Cook Islands. And actually, Dr. Tedros wrote to Justin Trudeau and suggested to him that he needed one of those. It was before the election, and we also wrote to the Prime Minister about it as well. But yes, other countries have one, and they do very well by it. So yes.
Wonderful. Thanks for your question. Here's another question. How can we increase visibility of the association? I honestly was unaware of what exactly the association does.
You know, and I just told you that we were across the country at 50 meetings and more than 1,000 nurses, and we held the meeting if only one nurse showed up or 2 people showed up, and in some cases there were 200 there, right? So, and we called them engagement and dialogue sessions. And you know what? Whoever asked that question, we heard that over and over again. You just don't know what you do. We just don't know what you're about. And I got to say, in Manitoba, we have a very strong professional association, the Association of Regulated Nurses in Manitoba, that works in concert with us. So I'm going to sort of put that challenge back. How do you think we can increase the visibility of the association? Because it is an absolute pillar of our profession, absolute pillar, and we don't want to let it go. We do not want to let it go. We need to feed it, keep it strong, grow it. It is a very, very important piece of our profession.
Mm-hmm. And I think you're right, like now's the time, right? So like now that we're talking and now that we're seeing all of these issues come to the surface, it's so paramount that we really come together collectively and start to work together to bring it. Yeah.
So there's a great question there. It says, who is the person who influenced you in your leadership and in your career? And I'm going to say many, many people did along the way. But just a couple that come to my mind. And I actually found found the book. I don't know if I can just put my hand on it right here. But when I was a child, I read a book about Florence Nightingale, which is rather interesting. And when I look at it now, because I still have it, it's called a How and Why book. I read it now and I think I don't know what motivated me or moved me then. But so Florence Nightingale, I would say, and I do draw inspiration from her writing and from her work and from her thinking. And so not that I knew her, but that definitely influenced me. And I would say very early in my career, a woman named Vivian Campbell tapped me on the shoulder and said, you know, Claire, you would make a great manager. You will be a very strong leader. And I'd like you to step up to this position and I will support you as you step up in that. So I would say Vivian Campbell was sort of my first sort of step away from point of care into a formal leadership position. I would say Helen Glass as an instructor and as a faculty member in terms of her global view, her belief in nursing and the professionalism of nursing, and many others across my career, but those would be three in particular. And you know what? I'm going to say my mother-in-law. My husband's mother, Joyce Betker, was a nurse and believed in it and was a very strong nurse and a very strong supporter of mine. So I would say that also influenced me. Yeah.
Speaks hugely to the mentorship. Hey.
Yeah. Yeah.
Thank you so much for sharing this with us. Very exciting and hopeful. Can you make any suggestions for effective local agency on behalf of patients, even as local as a ward level to management and administration?
Okay, so I have actually a lot of thoughts about advocacy and advocacy on behalf of patients. First of all, if you read the Code of Ethics, we're obliged to advocate on behalf of our patients. So that's there. Code of Ethics supports you in that. And when we revised that Code of Ethics in 2017, the union was at the table, the regulator was at the table, CNPS was at the table, so the liability protection. So what's in there is supported by all of those sort of parts of our professional pillars. My question is, what's the difference between the individual patient and the community or the population as a patient, right? And I would challenge that we would have the same responsibility to advocate on behalf of the population, and especially those who are disadvantaged and are vulnerable, and those that are experiencing the effects of the social and structural determinants of health. But another thought I've had, and I've said this many times, if you can't call that work advocacy, then call it leadership. Just frame it as leadership, because when you call it leadership and leading, it seems to have a little safer kind of perspective to it. And then the other thought I have is use the professional associations. Use the Canadian Nurses Association, the Association of Regulated Nurses of Manitoba, that collective voice. We say, we're an advocacy organization. That's what we are. And so we can advocate. So I think those are some of my ideas. At a ward level and to management and administration, what I've found in my career is you've got a collective voice. If it's bringing a solution, not just an issue, but something that people could actually get behind and do something about. And if you can bring good evidence that this will actually make a difference, you get a little bit further. And I've also been a big believer in kind of the chip away or relentless incrementalism is what Barb Shellian would call it. So, you know, maybe you can't get all the way, but can you get a bit of the way or a couple of steps, you know? So how do you take those small steps sometimes before that system change? So. Mm-hmm. And don't forget about policy. Policy are some of the biggest levers we have to make really big change in systems and in society. And nurses are very good at policy, very good at policy. So don't discount working in the area of policy. And I mean social policy, big P policy, right?
Okay, thank you. Do you think nursing profession in Canada would benefit from a competency-based education, similar to many models of medical schools?
That's an excellent question. And I don't know that I could really do a very good job at answering that. I've done a lot of work in my career, interestingly enough, just divergent kind of paths on competency-based workforce development and practice development. So I like competencies and I like the use of competencies, but I don't know that I could speak to the education. So.
All right. What is the most valuable thing you've learned during your time with CNA?
Well, a couple of things. We're more alike than we are different. So while there is diversity, and while we can't assume that we're all alike, there's more common ground there than sometimes is easily apparent. So that was a valuable thing. I would say that and I've learned this lesson before, but I learned it again, and that's the lesson in the possible. You can make big change and you can move things ahead. It takes the effort a lot, and it takes often a lot of really hard work. So I learned that lesson again. And the other really valuable thing, and I talked about partnerships, but I wanted to, in those 4 years, talk to as many nurses as I could and really hear them, hear their stories. And so I had some kind of wild ideas about how I might do that. But my opportunities to talk to nurses came in very ordinary ways. And so I think the valuable thing I learned was to be open to those possibilities. I told you earlier, I said yes wherever I could. And by saying yes, I found myself talking to thousands and thousands of nurses over the last 4 years. And for me, that's incredibly valuable and something that I'm very grateful for. And I'll carry with me as one of the highlights for the rest of my life. So thank you for that. And tonight's part of it. So.
Okay, so we have a couple more questions. Oh, one more here. So what is next for you in your career? We'd love for you to stay in Manitoba. I was going to ask this question too. What's next? Being a grandma.
I don't think so. Yes, being a grandma for sure, but I don't think I'm finished. I don't feel that yet. And I'm blessed with good health and the capacity to work, and I'm very grateful for that. So what's next? I'm the scientific director at the National Collaborating Center for Determinants of Health, and I'd really, really like to dig into structural determinants, so that those really high-level policy pieces that actually affect health in a really big way. So I'd like to do more reading and research and understanding of that. I know my family would really like me to be in Manitoba too. So whoever said that, I don't think I'll go very far. This is home for me. So I have my job and I'll do that. But I've been asked that question many times, and I'm actually very excited to kind of dig into that role of scientific director. It's knowledge translation. It's about equity. It's about the determinants of health. And I think we have, again, a really, really good opportunity right now to bring solutions to the table around that. And I've been blessed with these incredible networks right now, and a lot of people that I've met and that I know. So I hope to be able to use those right now. But if you've got any other ideas, I'm open to them. But yeah, I don't think I'm
saying yes.
I don't think I'm going far, but I'm also not finished. So
that's great.
A great question. Thank you. I didn't expect that one.
Right. Okay, so I don't see any other questions here, and we are just about at our time for 9 o'clock. So just wrapping up, I want to thank you so
Melanie,
much.
one more question right there.
Oh, sorry, just came on.
Yes.
Okay. Here we go. Sorry about that. One more question. Oh, here we go. It's more of a comment. Dr. Betker, you would be an asset in the world of Canadian politics. And someone else says, thank you for your presentation. And as well, another thank you for your leadership as president of CNA. And I commend you on achieving your commitments.
Oh, thank you. It was an interesting to go back and to reflect on that, those 3 Bs and my commitments 4 years ago. And yeah, I feel when sort of that journey of gratitude, I feel very thankful. And I'm quite pleased when I looked back over this last week. I actually feel like those were my commitments, and I stayed steady on them. The Canadian, there's woohoo mom. Thank you, Stephanie. The politics one is really interesting. With this COVID-19, I've done an enormous amount of media, and it's not something that I would go looking for, but you know, I've developed a bit of not too bad skills in the media. So the politics requires a lot of media. So anyway, thank you so much for having me, and thank you so much for nominating me. It's because of you that I've had this journey, so I am extraordinarily grateful to you. And I will be back in Manitoba and ready to keep on working and keep on supporting the beloved ARNM. So thank you. Yeah, thanks.
Thank you very much. And thank you for all your questions out there on the forum. So I am going to pass it to Mary now, and have a good evening all.
Okay. Thank you very, very much, Claire and Melanie, for tonight. There's one final comment that I'll speak to. It's thank you, Claire, for your leadership, being one of the founders of the ARNM, for your leadership with CNA, as well as everything that you have done for community health and public health. I think that's a beautiful summary of thanks for sure. And for all of you who have joined us tonight, so appreciate you coming. And I hope that you found tonight as enjoyable as I did, and that you will keep coming back to our Talk Tuesdays. I encourage you to visit CNA's website as well as our COVID-19 page for that credible, up-to-date resources and supports. There is a wealth of knowledge out there, and it's so important that we as health providers are focusing on those credible sources and encouraging the public to do the same. So again, just to close off tonight, I want to thank each of you for coming to this very special National Nursing Week Talk Tuesday. I am so proud to be a nurse and so proud to be able to be in this position to work with all of you and just appreciate all that you're doing out there during this very challenging time. But it's, we all should be very lucky and grateful that it is really showcasing nursing. So couldn't ask for a better platform during our International Year of the Nurse and Midwife. So thank you, everyone. I will close off for tonight. Hope to see you next week. Take care. Good night. And happy Nursing Week.
Yeah, thank you. Thanks, everybody. Bye now.
Bye-bye.